Hi everybody, my name is Kathy Abreu. I'm a registered nurse and owner of Navita Health Advocates. Welcome to this week's Think About It Thursday. Today I'd like to talk to you a little bit about diabetes. Diabetes is a very common but very serious disease that is reaching epidemic levels in our country today. So just what is this illness? Diabetes is a condition that causes your blood sugar levels to rise higher than normal. Our bodies use a hormone called insulin to move blood sugar from our blood into our cells where it can be used for energy. There are two types of diabetes. In type 1, your body does not produce any insulin. This is usually diagnosed in childhood or young adulthood, and actually only about 5% of people with diabetes have type 1. In type 2 diabetes, your body does not use insulin properly. This is called insulin resistance. At first, your pancreas makes extra insulin to make up for this, but over time, it is unable to keep up and cannot produce enough insulin to keep your blood sugar at normal levels. While there is no predictor for who might get type 1 diabetes, there are certain risk factors to determine whether or not you might acquire type 2 diabetes, and these include a sedentary lifestyle and unhealthy diet choices. So, how do you know if you have this disease? Well, there are certain symptoms, but it's very important to understand that many people with type 2 diabetes do not experience symptoms, so do not even know they have the disease. The symptoms include frequent urination, extreme thirst, extreme hunger even though you're eating, extreme fatigue, blurred vision, cuts or bruises that are slow to heal, unexplained weight loss for type 1 diabetes, and numbness, tingling, or pain in your hands and feet for type 2 diabetes. Now, if you're experiencing any of these symptoms, please talk with your doctor. He or she may suggest you be tested, and there are 3 common blood tests that we use to diagnose diabetes today. The first is called an A1C, and this measures your average blood sugar level over the last 3 months. The next is called a fasting blood sugar test, and this measures your blood sugar levels after you have not eaten anything for 8 hours. The next is called a glucose tolerance test. In this test, your blood sugar is measured before and 2 hours after drinking a special very sweet drink. Now there are pros and cons to each of these types of tests, so talk to your doctor about which one might be right for you. Now, one of the risk factors for type 2 diabetes that I did not mention is something called prediabetes. Prediabetes means that your blood sugar levels are higher than normal, but not quite high enough to be diabetes. What this means, if you have prediabetes, is that you may develop type 2 diabetes over the long run or maybe in the near future. It also means that your chances are higher of developing heart disease or of having a stroke. The good news is that there are things you can do to control prediabetes that will prevent or delay you getting type 2 diabetes, and they include implementing regular exercise into your lifestyle and changing your diet. I hope you found this interesting and useful information. If so, please like it, share it, and tune back for next week's Think About It Thursday, where I'll be talking about some conditions related to diabetes called hypoglycemia and hyperglycemia. Also, be on the lookout. I will be posting an article online as a follow-up to this video with more in-depth information about the subjects we've talked about. Thank you for watching, everybody. Kathy Abreu, Navita Health Advocates, by your side for your best health.